Hello, everyone. In this section, we're going to discuss personality disorders. So, these kind of disorders reflect kind of a long standing, inflexible pattern of behaviors, thoughts, and emotions that are typically maladaptive. When these patterns interfere with work, relationships, or just everyday functioning, then they could meet the threshold for a clinical diagnosis. Now, it's important to remember these aren't just quirks or a person who's a little difficult. Personality disorders are persistent and can cause significant distress or impairment. So, the first one that I'm going to talk about is borderline personality disorder. You often see it abbreviated as BPD. This disorder is marked by intense disturbances in identity, mood, and impulse control. People with borderline personality disorder may have a deep fear of abandonment and rapidly shifting emotions. One moment they may idealize someone, and the next moment they may feel extreme anger toward them. Um, Although it can affect around 1 to 2% of adults, borderline personality disorder is often seen as being serious, and it can lead to self-harming behaviors. Um, so there is a often a history of trauma or abuse with these individuals, suggesting that there's possibly a strong environmental component in the development of this disorder. So traditional therapies don't typically work well for borderline personality disorder. So there is a version of therapy known as dialectical behavioral therapy, or DBT, um, who developed by a psychologist, Marcia Linehan, I believe, and has become kind of the gold standard for treatment of borderline personality disorder. And so DBT combines behavior therapy, cognitive therapy, psychodynamic therapy, and mindfulness based strategies. And it helps clients to learn how to regulate their intense emotions and to tolerate distress and improve their relationships. Importantly, DBT also emphasizes like acceptance along with change. So it teaches clients to accept themselves while they're working to grow. Another type of personality disorder is antisocial personality disorder. This disorder is characterized by a disregard of others' rights, manipulation, deceit, and lack of remorse. Um, so, a kind of an extreme form of this is psychopathy. And so, people who have traits associated with psychopathy can actually appear to be charming and intelligent individuals. But behind that, there's this profound lack of empathy. Um, Along with the concepts, personality traits of narcissism and Machiavellianism, um, psychopathy, these three form what people call the dark triad, which is this cluster of traits associated with exploitation and manipulation. Antisocial personality disorder affects about 1 to 4% of people in the United States, mostly men. There are brain studies that suggest that there is reduced cortical arousal in this, meaning that they're kind of less reactive to stress or punishment. So treating antisocial personality disorder is a big challenge. Most individuals don't want to change, and can even try to manipulate the therapist. There is some evidence that stimulants have shown some short term success by kind of boosting their arousal levels, but the effects don't typically last very long. Most forms of psychotherapy are not very effective, though there have been some behavioral approaches, especially kind of like operant conditioning techniques that's had some modest success. Um, Especially if we're kind of talking like in a more residential treatment setting. Um, Interestingly, symptoms often kind of decrease after the age of 40. And so this could be due to some biological changes. Um, and so, or it could be that people just kind of gain a greater insight into the consequence of their actions as they age. Dissociative disorders involve disruptions of identity, memory, or consciousness. So these can range from anywhere from a short period of forgetfulness to profound changes in identity. So dissociative amnesia is where a person forgets their personal facts, or loses awareness for a period of time. In the kind of the most extreme version of this is something known as a dissociative fugue, where a person might actually travel off to a completely new place, assume a new identity, and have no memory of their past. It's just they just become a new person. Dissociative identity disorder. So this is what was formerly known as multiple personality disorder, but we would modern call it dissociative identity disorder. And so this involves the presence of two or more distinct identities within the same person. Most people diagnosed with dissociative identity disorder are women, and they often report severe childhood abuse. Um, it should be noted that dissociative identity disorder is a pretty controversial diagnosis. It Not everyone really buys that it is kind of what it appears to be. That sometimes maybe it is diagnosed incorrectly. That being said, there is some research evidence that suggests that this kind of formation of multiple personalities can be a coping mechanism that people use, where they can kind of compartmentalize a traumatic experience by creating these kind of different personalities. So another kind of category is the feeding and eating disorders, which kind of go along with issues related to body image. So these kind of disorders are typically emerge in adolescence or early adulthood, and they're 4 times more common in women than in men. Um, so the first one I'll mention is anorexia. And so people with anorexia have this intense fear of gaining weight, and they have a distorted image of their body. So even when they are underweight, they might see themselves as still being overweight. Anorexia is especially serious because it can lead to heart problems and loss of bone density, and has one of the highest mortality rates among psychological disorders. Another example of this is bulimia. And this involves cycles of binge eating following by some type of purging. So something like vomiting or using laxatives. People with bulimia are typically average weight or even slightly overweight. So the disorder may be less visible than some other types of eating disorders. Binge eating disorders differs because it doesn't really involve. I'm sorry, binge eating disorders. Uh, so this is kind of different because it doesn't really involve a purging. Instead, people eat large amounts of food in a short period of time, often when they're not even hungry. And then they have this intense guilt or shame afterwards. This one is more common in men than what we see than women, like we see in anorexia or bulimia. And many people with this disorder also struggle with obesity.